Do you want to walk out of the NCLEX exam feeling like you just walked out of a first grade spelling test? Hang out for a minute and I'm going to show you exactly how you can do that. Alright, so the NCLEX is based on a few algorithms and rules that make it different from anything you've ever taken before. But first of all, you got to know that the NCLEX is a Computer Adaptive Test, or CAT. What that means essentially is it bases what it gives you on question 2 on how you did on question 1. So if you got question 1 right, it's going to give you a little bit harder question on question 2. If you got question 1 wrong, it's going to give you a little bit easier question on question 2. So that means that every single nurse gets a completely different NCLEX because it changes with every single question that we take. Now that can feel really intimidating because we've never taken exams like this before. So it uses a couple different algorithms and rules to make this computer adaptive testing work. The first algorithm to understand is that the NCSBN, who administers or writes the NCLEX, has a passing standard. That means that you must score above that passing standard to get your RN. If you score below it, that means you fail the exam and you must retake it to get your RN. So before you even walk in, there's a passing standard that you must score above. Now, how do you score above that? The second algorithm you need to know is something called 95% confidence interval. What that means is the NCSBN is always trying to determine within 95% confidence where you're going to score or how you're going to answer a specific question. So when you go in there, your confidence interval is really wide. Everyone starts with the same one. It delivers you a random question, and as you get that right or wrong, that confidence interval starts to close. In order to pass the test, that confidence interval must get above the passing standard. If it doesn't, you fail the exam. So because of this, it doesn't matter how many questions you get, it doesn't matter how long it takes. All that matters is that that confidence interval, or how certain the NCSBN is that you'll get a question right or wrong, must be above the passing standard in order to pass. So now we understand computer adaptive testing, we understand passing standard, we understand 95% confidence interval. Well, what are they going to ask us? Okay, the NCSBN is going to deliver you questions from 4 different categories broken out into a total of 8 subcategories. Okay, so the first thing they're going to test you on is safe and effective care environment. How well do you create a safe environment for your patient? The next thing they're going to test you on is health promotion and maintenance. All right, are you promoting health for your patients? Are you helping them maintain their health? Then it's going to test you on psychosocial integrity. How are we taking care of our patients' psychosocial environment and abilities? Then it's going to test you on physiological integrity. Things like basic care and comfort, pharmacological and parenteral therapies, our medications, reduction of risk potential, and physiological adaptation. So in total, we're being tested on 8 subcategories, with most of the questions coming from management of care. That's the biggest category, with 17 to 23% of your questions coming from that category. So whether or not you're getting questions right or wrong, it's still going to be delivering you questions in these 8 subcategories in different percentages. So now we understand the basic algorithms that run this computer adaptive test engine. Let's talk about some of the rules then that help feed into these algorithms. The first is the number of questions you're going to get. For NCLEX RN, it's going to be anywhere from 75 to 265 questions. It's also limited to 6 hours. You can't go beyond 6 hours. If you hit 6 hours and you're not done with the test, or it hasn't been determined if you passed or failed, you automatically fail. Then you also get a couple 15-minute breaks during the test. So I recommend after 75 questions, regardless of result, if it goes to 76, take a break right there and just get your mind out of that whole thing that it didn't end at 75, and don't worry about beating yourself up, just take a break. And so a couple other things that we get, guys, we get a few FAQs, a couple general questions about the exam. One of the ones we get is, does it test you on generic or brand names of drugs? It's always going to test you on generic names. It doesn't care that you know Tylenol, it wants you to know acetaminophen. All right, so focus on learning your generic drug names. The other one is, do you get a test report after you pass or fail or when you walk out of the exam? The answer is no. The only time you get a test report is if you failed the exam, and all it's really going to tell you is you were near passing in this basic care and comfort, you were below passing in pharmacological therapies. So it doesn't give you a ton of help, but it lets you know if you're near passing or if you passed. I suggest focusing on those areas that you were near passing and just try to bump those up a little bit to get yourself to pass. The other question we get is, does it bold any words? And yes, it does. It bolds words like best, first, priority, things like that. So really pay attention to these bold words because it's going to help you know it's a priority question that you must focus on that word. One last question we get a lot of times, guys, is are you allowed to skip questions? The answer is no. You must answer every question in order to advance to the next question. All right, so that's some of the basics of how the NCLEX works. Now, guys, do you want to know how to get better at anything in life? The answer is practice. I know that's not a sexy answer, that's not some fancy answer that you're probably hoping, but the answer is practice. You can't expect to be an expert skier the first time you get to a mountaintop. It takes time, dedication, focus, and attention. So why should it be any different for the NCLEX? If you want to walk in and dominate the NCLEX on your first try, you've got to practice. Now, while practice banks and test banks are good for general practice, it doesn't give you that real testing environment that is going to help you walk in and just know you're going to dominate on that first try. That's one of the main reasons we built our patent pending, completely revolutionary computer adaptive test called SIMCLEX. This is the only test of its kind. We built this so that you can walk in fully confident on NCLEX day that you know exactly what to expect and that you're going to walk out passing the test and get your RN. Let me ask you a couple questions. Are you completely confident that you're going to pass the NCLEX on your first try? And how confident are you that you know what to expect when you walk into the NCLEX? Now, I've been sitting exactly where you're sitting right now. You're either a nursing student starting to think about the NCLEX, or you just graduated and you've got your NCLEX scheduled. Either way, you've spent tens of thousands of dollars, time, money, sacrifices to get where you are, but there's 5 letters standing in your way, NCLEX. So let me introduce you to SIMCLEX and show you 6 reasons why SIMCLEX is the best way to prepare for the NCLEX. Reason number 1, adaptive testing algorithms. Just like all those different algorithms that I showed you in the beginning, SIMCLEX does all of that. This is a huge task, and this is why we're the only ones doing this. Because it's hard, it takes a lot of time, but we're doing it for you guys so that you know exactly what to expect and see all those different adaptive algorithms before you ever take the real NCLEX. Reason number 2, all the same rules that apply on the NCLEX apply on the SIMCLEX. We've got the question limits, the time limits, the bolded words, all the same things that you're gonna see when you see that test screen for the first time when you go in to take your NCLEX. Reason number 3, 6,000 plus questions. Every single question in the SIMCLEX question bank was written by an NCSBN trained question writer. And it's been vetted by hundreds of thousands of nursing students just like you. This not only makes SIMCLEX the largest nursing question bank, it also makes it the most accurate way to prepare. Reason number 4, detailed analysis and rationales on past tests. What good does it do to take all these practice questions if you don't know how you're doing? For every question inside SIMCLEX, we give you a detailed rationale of how you did on that question and an overview of how you're doing on each test. Reason number 5, alternate format questions. The NCLEX doesn't just give you 4 answer options and let you decide between those or true, false, or anything like that. It also gives you select all that apply questions, and it gives you hot image questions and things like that. So we built those question types into SIMCLEX so that not only do you get the same environment and same algorithms, but you also get the same question types that you're gonna see. And reason number 6, you can know exactly what to study next. With each full test review, we tell you how you did by each NCLEX category and by nursing categories. So you can see that you did really well in cardiac maybe, but you did really poorly in OB. You can go back and study different courses and different lessons on that. Are you ready to feel fully confident that you're gonna pass the NCLEX? I want you to walk into that test day like it's a first grade spelling test. That's the reason SIMCLEX exists. Head over to nrsng.com to check out SIMCLEX and read reviews from students just like you who have used SIMCLEX and passed NCLEX. I know you guys can do this. I want you to go out and be your best selves. Happy nursing.